Today we announce 528 new cases of COVID-19 and 7 additional deaths. This brings the total number of cases in South Carolina to 15,759, and the total number of deaths to 575. And I have to say that today I am more concerned about COVID-19 in South Carolina than I have ever been before. For the past 2 weeks, we've seen some of our highest daily numbers since the pandemic began, and there have also been recent increases in our percent positive, which tells us that more people than we would hope for who are being tested are sick. This is why we need everyone's help in re-emphasizing how critical it is for every one of us every day to wear a mask in public and to stay physically distanced from one another. Those two precautions, masks and social distancing, are how we stop this virus. Yesterday, DHEC issued a joint statement with the South Carolina Hospital Association and the South Carolina Office of Rural Health, reiterating how vitally important it is for all South Carolinians to adhere to these disease prevention methods. So we're all eager to return to our normal lives, or what our new normal will be, but it will take us that much longer to get there if we don't stop the virus today. It doesn't take hard data to observe that many people across the state aren't social distancing and aren't avoiding group gatherings and aren't using masks in public. And we really need all South Carolinians to take these precautions every day, not just to protect ourselves, but to protect others who could become severely ill or who could even die if they're exposed. Our increased testing data has allowed us to better identify hotspots, and this has recently included Greenville County. Greenville County has seen some of the highest daily case counts for any county in the state for over a week and a half. And when we identify a hotspot like Greenville, we dig deep into the data, and we use the confidential information provided to us and our epidemiologists' work to help identify risk factors that could contribute to the spread in these areas. For Greenville, we've determined that several cases are stemming from some households, meaning that family members are infecting each other not unexpectedly in their homes. And that's why it's important to follow the advice of healthcare professionals and to stay in isolation and quarantine if you're diagnosed or you're a contact. And this helps protect your family. But we've also determined that approximately 31% of recent cases in Greenville have been occurring in a large Latino population. And so we've immediately targeted our outreach to efforts in these communities. And this has included interviews on local radio stations, Latino radio stations, and the redistribution of our Spanish-translated educational information and resources in these areas. We continue to increase COVID-19 testing availability in Greenville, and with the thanks of local hospitals and healthcare providers in healthcare facilities in those areas, we continue to work with community partners to accomplish that. And while we work to identify hotspots of virus activity in the state and take extra steps to help stop the spread of the virus in these areas, I ask everyone who's listening to me now to ask yourself how you can possibly help to stop the spread of the virus, what you can personally do to protect yourselves and to protect your communities so that we can return to normal activities sooner rather than later. This will help us reduce the impact of the virus that we are all experiencing if we take these individual measures and ask ourselves if there's more that we could do to stop the spread of the virus. Your community might not be a hot spot today, but there should be no mistake that COVID-19 transmission is still high and widespread in South Carolina at this time, and it remains a threat to all of us. The preventive measures that we are encouraging are really the only things that we have right now to keep us safe in the absence of a vaccine. We know that what we've been asking everyone to do is not easy, but I can't stress enough that it's really absolutely necessary. And working together, we can turn the tide on COVID-19 and help save more lives in South Carolina. Thank you.